gentlemen, please welcome our guests for the day, our keynote speakers, our dignitaries. आपकी तालियां थोड़ी कमजोर है, एक बार जोरदार तालियों से हमारे गेस्ट का स्वागत कीजिए।
碧海潮生曲，快静坐运功。
तालियां रुकनी नहीं चाहिए, हमारे गेस्ट हमारे बीच आज आ रहे हैं, एक बार जोरदार तालियां हो जाएं आप सबकी। We'll be having 4 keynote speakers with us today, few dignitaries and our HODs. आपकी तालियां थोड़ी कमजोर हैं, जोरदार तालियों से हमारे गेस्ट का स्वागत कीजिए। Ladies and gentlemen, I welcome you all to Good Health and Well-Being by Physical Education and Sports, jointly organized by School of Physical Education and Physiotherapy, School of Allied Medical Sciences, lovely professional university. We have amidst great eminent personalities. Amongst a thunderous round of applause, please welcome Dr. Sanjay Modi, respected Pro Vice Chancellor, lovely professional university. Dr. Monica Gulati, Executive Dean and Registrar, lovely professional university. A round of applause for ma'am as well. And we have our keynote speakers, Dr. Inderdeep, Master of Chirurgy, Orthopedic, Amandeep Hospital, Amritsar. Professor Dr. Arvind Malik, HOD, Physical Education, Kurukshetra University. Professor Dr. Sanjay Sharma, Dean, Faculty of Education, Director of Sports and Youth Affairs, HPU, Shimla. Dr. Rahul Tiwari, Biomechanistic Lead, SAI, Netaji Subhash National Institute of Sports, Patiala. We also have with us Dr. PP Singh, Senior Dean and HOS, School of Physical Education, lovely professional university. Dr. Neelam Sharma, Professor and Deputy Dean, School of Physical Education, lovely professional university. Dr. Suresh Mani, Deputy Dean, School of Allied Medical Sciences, lovely professional university. All HODs, faculty, staff and students, I warmly welcome you all. And with this, I'd now request Dr. Sanjay Modi, respected Pro Vice Chancellor, lovely professional university, to extend a floral welcome to our keynote speaker, Dr. Inderdeep Singh, Master of Chirurgy, Orthopedic, Amandeep Hospital, Amritsar. एक बार जोरदार तालियां हो जाए, ladies and gentlemen. I would now request Dr. Suresh Mani, Professor and Deputy Dean, School of Physical Education, to kindly extend a floral welcome to our keynote speaker, Dr. Sanjay Sharma, Dean, Faculty of Education, Director of Sports and Youth Affairs, HPU, Shimla. I would now request Dr. Rakesh, Assistant Professor, School of Physical Education, Dr. Varun Kalia, Assistant Professor, Department of Physiotherapy, to kindly extend a floral welcome to our keynote speaker, Dr. Rahul Tiwari, Biomechanistic Lead, SAI, Netaji Subhash National Institute of Sports, Patiala. I would now request Dr. PP Singh, Senior Dean and HOS, School of Physical Education, lovely professional university, sir, to kindly extend a floral welcome to Dr. Sanjay Modi, respected Pro Vice Chancellor, lovely professional university. Ladies and gentlemen, a round of applause.
碧海潮生曲，请。
I would request PP sir again to kindly extend a floral welcome to Dr. Monica Gulati, Executive Dean and Registrar, lovely professional university. I would now request Dr. Neelam Sharma, Professor and Deputy Dean, School of Physical Education, lovely professional university, to extend a floral welcome to our guest, Dr. Sandeep Singh Saini, Professor and Principal, College of Physiotherapy, CMCH, Ludhiana. Thank you, sir. Thank you, ma'am. And henceforth, we will be proceeding with the lamp lighting ceremony, and I would request all the dignitaries and keynote speakers to kindly come forward for the lamp lighting ceremony. All our dignitaries, Dr. Sanjay Modi, Dr. Monica Gulati, Dr. Inderdeep, Dr. Arvind, Dr. Sanjay, Dr. Rahul, Dr. PP Singh, Dr. Neelam ma'am, Dr. Suresh sir, Dr. Sandeep sir. Can we have a round of applause, ladies and gentlemen? With this burning lamp, the pious fire, we invoke the blessings from Almighty for our guests, our speakers, our faculties, our staffs, and our dear students. May these blessings help us in expanding and growing our careers and our lives. Can we have a round of applause, ladies and gentlemen? Thank you, sir. Thank you, ma'am. And with this, I'd now request Dr. Monica Gulati, Executive Dean and Registrar, Lovely Professional University, ma'am, to kindly come to the dais for her welcome address. Ladies and gentlemen, can we have a thunderous round of applause? Yes, ma'am.
So very good morning to all of you. Good morning. So on this occasion, when the expertise of two departments, two schools have amalgamated to give you the most valuable kind of information, I welcome all the delegates to this conference. I extend a hearty welcome to Professor Sanjay Modi. Thank you, sir, for joining, and I would also like to welcome Dr. Inderdeep Singh, who is basically an orthopedic surgeon, currently at Amandeep Hospital, Amritsar. I would also like to welcome Dr. Professor Arvind Malik in absentia. He will be joining us soon. He is probably stuck in some traffic at Haryana. Professor Dr. Sanjay Sharma, thank you, sir, for joining us. And Dr. Rahul Tiwari, who has come from SAI. You are all very well aware of, the Institute of Excellence, SAI, which is based at Patiala. So I can expect some applause from Therapy APG College, Jalandhar, Dr. Shilpi, and Dr. Maman Paul. From Guru Nanak Dev University, Amritsar. I understand some of them are about to join us. And most importantly, I would like to welcome all the delegates and all the students. So as you can see, it is a very different kind of conference in which you will have, an expert kind of input from very varying kind of accomplished speakers, and then we'll have some very good deliberations followed by the presentations from the delegates. So I would like to request just one thing: try to gain the maximum out of it. Ask questions wherever you feel you need to ask. Most of the speakers, all of the speakers on their behalf, I can assure you, they'll be very happy to answer any queries, any questions. So don't carry any doubts in your minds from this auditorium. And I wish a huge success to the organizers, both from the Department of Physical Education and Physiotherapy, led by Dr. P.P. Singh, Dr. Neelam, and Dr. Suresh Mani. So thank you for arranging such a wonderful kind of event. Thank you.
Thank you so much, ma'am. And now I would request Dr. Sanjay Modi, respected Pro Vice Chancellor, Lovely Professional University, sir, to come to the dais and set the context of this international conference. Can we have a round of applause, ladies and gentlemen?
Good morning, everyone. Experts on the stage, keynote speakers, delegates to the conference, and dear students, and of course, colleagues. For me to set the context, I'm not a science man, but then at times I feel that an outsider's viewpoint, the viewpoint of a novice, also perhaps at times serves some useful purpose. So I dare to challenge myself and say a few words in this conference of scientists. I'm none of these. I've not studied. I gave up science right from class 8. But then it's interesting to be among those people of science and surgery to be able to speak on certain issues. Let me start by saying that why sports science has become very significant is that sports have become extremely competitive. And there is no nation of the world which is not wanting to score high in Olympics and other competitive events. India is absolutely ambitious and very ambitious about making its mark, and it rightly so. With a country of 1.4 billion population, I think we deserve a far better performance in the Olympics and other competitive sports. This is one dimension of it. This is why we need it. The second is, of course, it is not about competitive sports, it's about the health of the general population as well. And when I say this, I think before I say something else, I think all students who are here, researchers who are here, must keep it in mind that please do not take any of the events, including this conference, as a ritual that you are skipping your classes and be here just for the sake of participation. You should have in your mind certain learning outcomes which you must carry with you. Otherwise, it's a very precious time that you are investing, and if it goes waste, is something which is not intended and something which I think we all need to regret in case we don't go back with certain learning outcomes. So please stay attentive and carry certain things with you, which could be good research ideas, which could be some new concepts which you hear about, which you would like to explore, and which helps you to grow your understanding of the subject in times to come. Now, coming back, it's not about sports performance or physical strength. It's not about physical training anymore or, diet anymore. It has a lot to do with the human psychology as well. If somebody is psychologically very strong, one can, even with a less of physique, I often marvel. I don't know how much of research has gone into it. There could be some genetic reasons also behind this. You find very frail, not well-built Kenyan athletes doing so well in athletics, extremely well, whether they stay in America or they are part of an African team, they are doing exceedingly well in marathons and a lot of athletic events. Is there something genetic to it? Is it part of their psychological strength? You as researchers, we as a nation of scientists and researchers, we need to explore this. How much of our performance is connected to psychology? How much of it is connected to diet? There's a lot of controversy regarding vegetarian, non-vegetarian diet. I think the whole world is picking up threads from the Indian, writings of the past, whether it is Ayurveda or our scriptures. And, for example, fasting is something which is somebody gets a Nobel Prize in the name of, I think they call it autophagy or what? Autophagy. And somebody gets a Nobel Prize for recommending that, intermittent fasting is something which will do good to your health. And we have been doing it for ages. So why don't we look at our scriptures and figure out what does Ayurveda say about strength and stamina and psychological strength, what diet is recommended. I think there are plenty of things in Charak Samhita and our scriptures which can, and those need to be validated. The point to be noted is, you should pick out certain kind of clues from our scriptures, research them, validate what they're saying. The only problem with the Indian writings is nobody has validated them. The Westerners are secretly validating them and putting them as their own research, whether it is neem or haldi or there are thousands of things which they're copying. So I think we as researchers need to not necessarily follow what the Western world is doing. Of course, some good things need to be picked up, but then also look at what we have and validate and revalidate those kind of things, which will do us a lot of good. Because what is relevant for somebody who's staying in a cold country may not be relevant, the same diet may not be good enough for somebody living in the tropical region. Right? So this is how weather conditions and genetics and diet and psychological strength and genes, how they impact is something which we should figure out and see how we can research and clarify those issues in our own minds for the benefit of sports. Another thing is that, though it might sound a little out of context, but entrepreneurship in these domains is very, very important. Today, you have personal physical trainers, whether it is gyms or it is high net worth individuals, even above average income people, I have seen. I think it's so good to hear. Some of the students of physical education, I've been getting requests that they are holding classes in the morning in this AGI flat complex, early morning, and they charge 5,000 rupees per month. And they have, I've seen photographs and videos where they have about 15, 20 ladies and males and females who join for yoga sessions and learn yoga to improve their physical health. Now, those elements also need to be picked up. You need to see what is the scope of entrepreneurship. I think this, some people don't sit in such a relaxed position. If you want to sleep, you can excuse yourself. Don't sit in a sleeping mode. If you're physically in a sleeping mode, your mind will also go into the same mode. You are here for a conference, a scientific conference is something, it's a privilege to get a place here. Avail the best of this opportunity. Yeah? So be in a learning mode. In fact, I would expect if you have I would have appreciated if all of you were here with your notebooks and writing instruments to be able to take a few notes. Nobody has such a memory that you can remember everything which is being discussed. Even at this age, when I sit in a conference, I go with my writing pad and pen to make sure that I don't miss out on significant things. That's the learning mode you should be in. I was also sharing with the physical education people. I said you should collaborate further with the faculty of dietetics, nutrition and dietetics. Why not? A lot of research needs to be done on nutrition and dietetics. Look at what is happening to people who are going to gyms and building muscles and dying at such an early age. So let's strike a balance between how much protein is required. There's so much of talk on superfoods and proteins, and I think all those kind of things, instead of all of us following those fads, we need to research those things and put them to the public and say, this is what the reality is. So see if you can, in fact, it is not only for conferences. I would suggest that those of you as students also, at PG level also, I think you need to engage in multidisciplinary research, you should collaborate with, and this is happening. Collaborate in terms of pedagogy, in terms of other research area with nutrition and dietetics, physiotherapy, pharmacy, and even management for that. Sports management is a very emerging area. It's not only about diet, it's about management also. For instance, why would Vinesh Fogart lose a medal opportunity for a silver or a gold for whatever you know? She could have got it. Is that an issue of practice? It's an issue of sports management. Perhaps there was some lapse in managing the situation or making sure that the weight is being regularly checked. So it's more an issue of management than of anything else, physical training, etc. So all these things are interlinked, and these throw up, these kind of situations reveal the challenges which need to be addressed. Right? So you should all explore these and see how much you can learn and contribute to these dimensions. And I would once again exhort all of you that look and explore opportunities for entrepreneurship. Today, there's plenty. I keep talking to Dr. Neelam, how many of your students, I'm very happy that some students are going, and at one time we had, in the neighboring villages, we had put up volleyball nets, and so that people in the villages could play and stay away from drugs. That's also part of your training. That's also how you contribute to the society. Ultimately, higher education is something which solves problems of the society, whatever they be. Right? So be part of that solution. That's extremely important. And today, young kids, they have nothing to do. I mean, everybody is hooked to the mobile phones. I think in physical education, you should train your people if they can arrange camps during the period when the students are free from their teaching during summer. What do? Everybody is stuck to the televisions or to the mobile phones. Outdoor life is vanishing. Why? Because public places are getting eliminated for commercial reasons. Parks are vanishing. So get your people to organize small sports camps where you teach maybe yoga, maybe some other physical activity, so that the students can, and the parents love it. They're willing to pay for it. A company comes, they will explore it, and you will miss the opportunity. I have seen very, very young people of physiotherapy becoming independent practitioners and earning extremely well. So this thing should get into your mind that entrepreneurship is possible for everyone. You should be able to float companies of relating to whether it is physiotherapy or of sports science, and educate people about even females, the family men and women need education and awareness about sports science. They have no idea. They would to guide their kids about sports careers and health and general wellness issues. So I think there's a lot which these disciplines can do to contribute to improving the health, general health of the society, and building love for sports, and building a desire to excel and make careers in sports. Now, sports is a very paying business, So every sport is being rewarded. No longer it is about cricket only. It's about every sport. So I hope this conference would lead to a lot of meaningful learnings for the audience and throw up a lot of new areas of research, which I would exhort the students and the researchers and the faculty to please make note and make sure that those are the topics on which postgraduate research, PhD level research is getting done. I would request that if Sports Authority of India, if there are some challenges which the Sports Authority faces in terms of training or any other issues, they should be shared. I mean, you should learn from them and make those as your research topics, whether at PG level or for PhD research. Only then it is meaningful. Getting theoretical research, doing theoretical research, which doesn't solve any existing problem, perhaps is not as effective as it should be. So see that, I think, likewise, collaborate with hospitals and see what kind of problems patients come up with. Those should be your areas of research and practice. So I hope those things will come up, and we will work very hard to be very productive and contributing members of the society. And this is the best learning for the students and all of us. With this, all the very best wishes, and I'm so happy that this collaborative conference is happening for the second time. I hope this continues, and many other collaborative conferences happen, and a lot of collaboration happens at the level of students also in times to come. Thank you very much.
Louder round of applause, ladies and gentlemen. Can we have a louder round of applause? Thank you so much, sir, for your motivating and inspiring words. And the time has come that we were waiting for, the abstract book release. I would request all the dignitaries to kindly come forward. We'd be providing you the abstract book and would be requesting you to kindly unfold the abstract book, which is a culmination of hard work and turmoil put by our students and brought us with the research papers. Can we have a round of applause, ladies and gentlemen? It's a very, very good book because it's a culmination of hard work and turmoil put by our students, burning the midnight oil sometimes, and crafted this great book where we have the research papers. Thank you, sir. Thank you, ma'am. And with this, I'd be now requesting Dr. Sanjay Modi, respected Pro Vice Chancellor, Lovely Professional University, and Dr. Monica Gulati, ma'am, Executive Dean and Registrar, Lovely Professional University, to kindly felicitate our keynote speaker, Dr. Inderdeep Singh, Master of Chirurgy, Orthopedic, Amandeep Hospital, Amritsar. Ladies and gentlemen, can we have a thunderous round of applause for this? Our keynote speaker, who will be providing us various insights on topics like physical education and sports. I would request Sanjay Modi sir and Monica ma'am once again to felicitate our keynote speaker, Dr. Arvind Malik, HOD, Physical Education, Kurukshetra University. Sir, to kindly come to the stage. We would be witnessing the expertise on the field where sir has mastered in very shortly. Our keynote speaker too. Would request Sanjay Modi sir and Monica ma'am once again to felicitate our keynote speaker, Dr. Sanjay Sharma, Dean Faculty of Education, Director of Sports and Youth Affairs, HPU, Shimla. आपकी तालियां बहुत ही कमजोर है, एक बार जोरदार तालियां हो जाएं। Requesting Sanjay sir and Monica ma'am once again to felicitate our keynote speaker, Dr. Rahul Tiwari, Biomechanistic Lead, SAI, Netaji Subhash National Institute of Sports, Patiala. Welcome you, sir, once again to the second international conference. Your insights last time were really recommendable. Round of applause, ladies and gentlemen. Requesting once again Dr. Sanjay Modi and Dr. Monica ma'am to felicitate our distinguished panelist, Dr. Sandeep Singh Seni, Professor and Principal, College of Physiotherapy, CMCH, Ludhiana. I would request all the dignitaries to kindly come forward for a group photograph. Ladies and gentlemen, a thunderous round of applause for these great eminent pillars of lovely professional university and our keynote speakers who would be enlightening us all about physical education, good health, well-being and sports. And with this, I'd be requesting Dr. P.P. Singh, sir, Senior Dean in HOS, School of Physical Education, Lovely Professional University, to kindly come to the stage for vote of thanks.
गुड मॉर्निंग एवरीवन सर ने कह दिया गुड मॉर्निंग एवरीवन जोर से बोलो सर दे आर woke up now. I extend my heartfelt thanks to my mentor Dr. Sanjay Modi sir, Pro Vice Chancellor sir, who puts in very keen efforts into making all the things collaborative and meaningful. I assure you sir, this is the second episode. We'll continue with further collaborations as you have said about dietitics and others also. I extend my heartfelt thanks to Dr. Monica Gulati ma'am also for sparing the time and allowing us to collaborate with physiotherapy department. My heartfelt thanks to Inderdeep sir, Sandeep sir, Sharma sir, Sanjay sir, and my own friend Malik sir from Kurukshetra, my city mate. आज हरियाणा में इलेक्शन है and my thanks to Neelam ma'am for always being the spirit of all the schools where I am. With your presence, I am assured that things are going to happen in the right fashion, and Dr. Suresh Mani will always get us some tickets of aeroplane to go abroad also. Mani sir, bana nahi Cyprus ka, next time banaiega. Thanks to Dr. Vijay also, Dr. Namisha also. You always are around whenever my things are going on. Thanks to Rakesh and all the members from physical education and physiotherapy team who have contributed to this particular conference. And thanks to all the students also who are going to witness the further technical sessions where meaningful interactions and meaningful discussions are definitely going to happen. I welcome you all to the technical sessions, and heartfelt thanks to all the dignitaries on the stage and off the stage if I have missed out anyone. Thank you all.
Thank you, sir, for your kind words. And with this, I'd now request all our guests to kindly take their seats on the front row of the auditorium. Thank you so much for your enlightening and kind words.
All the students kindly occupy your seats. The session is not over yet. Volunteers कृपया गेट को बंद कर दें.
ये पहले कुछ बात कर ले कि क्या क्या क्वेश्चंस आप लोग को पूछने हैं करने हैं, ऐसा कुछ भी बीच में सारी सीटें भी खाली हो गई. करा ले भाई, करा ले, बेस्ट है भाई. जैसे सेंटर में जाके करा रहा हूँ.
So now we are preparing for our first keynote speaker. Meanwhile, I'll have some fun session with you. So, how many of you are from physical education? Quite a number. Physiotherapy. आप में से कितने लोग योगा करते हैं डेली? Quite a number again. So, हम यहाँ पे क्या करने वाले हैं? हमारे पास यहाँ पे 5 वॉलंटियर्स आएंगे आप में से और एक बैलेंसिंग योगा पोज करके दिखाएंगे. ओके? 5 people. Volunteers, please maintain your silence.
Requesting 5 volunteers to kindly come to the stage because there is some fun activity planned by Anand. So any 5 volunteers from physical education or physiotherapy can come to the stage.
Physiotherapy.
Also requesting folks kindly maintain the discipline and decorum. We still have our guests with us. Discipline committee members kindly adhere
Please
to that.
maintain silence. 5 volunteers. अभी योगा का पूछा था तो बहुत हाथ आए थे ऊपर. Anyone? अभी उनके लिए अवार्ड्स भी हैं हमारे पास. सोच लो. 1. फिजियोथेरेपी 3rd year. संदीप. संदीप. Yoga. Please give a huge round of applause for this gentleman. I need some more participants. Yes, 2nd. Physiotherapy से कोई नहीं है. Sandeep is here. Come forward, come forward.
योगा हाँ सर.
कोई भी अपने चूज कर सकते हो. होल्ड कितनी देर करना है? ठीक है.
कितनी देर करना है?
कॉमनली एक चूज कर लो, सब मिलके डिसाइड.
अलग अलग करेंगे.
सबका अलग अलग करेंगे. चलो ठीक है.
आंखें बंद करके.
ट्रीपोज आंखें बंद करके. पक्का ट्रीपोज आंखें बंद करके. शीर्षासन. शीर्षासन.
नहीं डिफरेंट करना है.
डिफरेंट करना है.
मेरा हेड स्टैंड है.
ठीक है, हम स्टॉप वॉच लगाएंगे. यस.
वही
ताड़ासन तो बहुत ही ताड़ासन तो ऐसे होता है. चलो एक बार जोरदार तालियां बजनी चाहिए इनके लिए. लाइन अप हो जाओ. शूज वगैरह पहनिए. बैलेंसिंग पोज होना चाहिए कोई.
मतलब कुछ देर होल्ड करके रखेंगे, वो बैलेंस है.
हाँ, कितने देर आप होल्ड कर रहे हैं? चलो. कौन सा करवाना है?
पहले एक रख के फिर हाथों को ऊपर करके फिर आंखें बंद करा के.
आंखें बंद करवा के करवाना. चलो
डिफिकल्टी लेवल.
ठीक है. मैं बकासन करूँगा. ठीक है.
प्रोफाइल देख लिया, बहुत बढ़िया.
कैन यू स्टार्ट? Hello space. Space. Can you start now?
यस सर.
एक ही करना है. वृक्षासन करना है. आंख बंद करके. ठीक है. हाँ, मैं स्टॉप वॉच लगाऊंगा. ठीक है. नहीं, सिंगल. सब वही करेंगे. हाँ. मैं स्टार्ट करता हूँ. ठीक है. Ready? Start. Close your eyes. Close your eyes, everyone.
जल्दी 2 मिनट करना.
आ जाओ भाई साहब आप. Okay, thank you, gentlemen. So, our guests have selected the winner. Any names from your side? Sandeep is the winner. Thank you.
पकड़ के नोट स्पीकर से प्रोफाइल देखो
So, please occupy your seats. आ जाओ.
रेडी मत फोन किसका फोन भूलिए
आप में से फोन किसका है ये फोन?
दोनों
नहीं.
डेजिग्नेशन है चलो मैंने लिंक्डइन पे वो भेजा अरे यहाँ से मत बोल मेरी बात यहाँ से बोल नाम पढ़ और उनका लिंक्डइन पे भेजा प्रोफाइल वो पढ़ते हैं बस खोल मैं फोन
प्रोफाइल नहीं बोल रहा नाम बोल देता हूँ. So, please give the loudest possible round of applause for our first keynote speaker for the day, Dr. Inderdeep Singh, MCH Orthopedic, Amandeep Hospital, Amritsar. Ladies and gentlemen, presenting you Dr. Inderdeep Singh.
और लाइट्स ऑफ हो सकती हैं तो ये वाली अच्छी है
आगे वाली लाइट ऑफ ये कौन सा
पीछे और आगे और यहाँ और
बस होना जाए
नहीं ऑफ ऑफ ऑफ
ये भी ऑफ ये तो लास्ट में बस ठीक है डॉक्टर साहब
पीछे देख लो एक बार
देखिए
ऑल गुड टू गो गुड माइक ऑन है So, good morning everyone. At the outset, I would like to thank the Departments of Physical Education and Physiotherapy for inviting me here to give a talk on advances in treatment of sports and ligament injuries. So, this is mostly a surgical videos which will be there in the presentation. But before that, I feel honored and I'm very humbled to be standing in front of you and talking on this. So, and I feel very proud when so this is my hometown. I did my schooling from Jalandhar. I belong to Kapurthala. So, but I'm working in Amritsar. So I feel very honored. So we did all our education and came back here and talking in front of you guys. And I'm sure you will take something out of this talk. And it will not be very boring, and please don't try to take a quick nap. I know you have been sitting here since morning and waiting for all of us to speak and talk something which is interesting. So be very careful. There are going to be some points which you can carry home, just not for you to learn as professionals, but these points will be valid even in your regular life. So sir was talking about sportsmen and performing in the Olympics, but I think even living daily, doing the activities of daily living are equivalent to sport nowadays. So because we have to run from one place to other, save our time, and we can injure ourselves during this process also. So this is the sports are every day. It's just not being performing in Olympics, but rather than doing the activities of daily living are equivalent to sports. So I'll be just talking on few aspects of it, few treatment strategies, how to deal with this, and more importantly, how to prevent all these. So treatment part come next. Before this is diagnosis, and before diagnosis I would say it's a prevention, because it's importantly said that prevention is better than cure. So how to prevent let these injuries happen. So I'll be talking on these. So can I have these lights off? The presentation will be properly visible. These lights. Oh. Okay. So So whenever we think about sports injuries, this is a video which comes in our mind, that person on a playground who is getting injured while playing sports. But the scenario here in our India, the things are totally different. They are not same. There are people who get injured while playing sports, but in India the things are different. They get injuries somehow like this, moving on a road, or even slipping from the staircase or walking down the ramp. So these are the scenarios which we commonly encounter when patients come to us when they injure themselves, just not the bones and even the soft tissues. So to classify these sports person, this is a vague classification. So they're professionals who have the source of income from the sports, and they play a professional sport. They are recreational players who are doing a desk job all throughout the week, but on the weekends they go and play. They play like match, and they can injure themselves. There are fitness freaks who are into sports on regular basis. They do a lot of gymming, a lot of bodybuilding, and there are a few dancers who are involved into acrobatic dances. And the next category, I would say, housewives. So they have to do their household works, and they have to manage the entire work in a particular time. So they have to run upstairs, come downstairs, do a lot of household chores in the process, which they can injure themselves. And the working ladies, really hats off to them. They have to manage the professional life, the personal life, and the household chores at the same time. So these are different kind of people who can get a particular sports injury. So sports injury just is not limited to sports person. It can happen to anyone from any walk of life. So this is a video of a boxer who is in the red, who while playing twisted his knee and injured his knee. So he has to come out of his match, and the referee has to stop the bout, and he has to quit the game. So these are the people who are like professional players who can injure their ligaments. So ligaments are nothing but they are just a soft tissue or a connective tissue which is joining two bones across a joint. So these soft tissue injuries can vary from simple strains, which are of various grades, or to sprains, which are again of various grades. There can be just a contusion over it, there can be abrasion, or there can be a clean laceration. So while playing in the ground, you can get a laceration or abrasion, which are very common injuries. So what to do when you get these kind of injuries? So it all started with this mnemonic which we keep in our mind as price. So we need to protect the area which has injured. We have to give rest to that area. We have to give icing over it, do a compression bandage, and elevate that part so that there is decreased in the response to the inflammatory markers. There is decreased swelling. There are low inflammatory marker accumulation, which lead to severity of the injury decreases. So of late, this has changed to polish, which means the PICE part remains same, but OL comes in place of R, which means optimal loading. So once you have given the initial inflammatory process has settled down, start optimally loading the area so that whatever collagen fibrils or the fibrosis which is happening, it happens in the line of stress. So you get a good quality collagen or a fibrosed area over that area. So you don't have to give a prolonged rest to that area. So you have to start optimally loading that area. So, and what not to be done. So this is very important. If you know what should be done, the more importantly is what should not be done. So never start whenever there is an acute injury, where it is an immediate injury, don't give a heat packs or the hot packs over that area. Don't start massaging it very harshly, rubbing that area, start running, or start doing the alcohol rubs over it. So which can actually increase the inflammatory response and give prolonged time to the healing. So remember, do not harm that area. So this was all about the soft tissue injuries, but there can be a bony injuries. So there can be fractures, there can be a dislocation. So fracture is just everyone knows that a breakage in a bone or in the continuity of a bone is called fracture. But if a joint is separated from the articular surfaces, it is called dislocation. So there can be a combination of both fracture and dislocation, so which is called fracture dislocation. So whenever you see these kind of patients who have a fracture, like a fracture in a forearm, so one is supposed to immobilize that area. So that area and a joint below that area and a joint above that area. Supposedly there is a forearm fracture which is somewhere here. So you need to immobilize the wrist along with the elbow joint so that there is less damage to the soft tissues and also to prevent damage to the nerves and the blood vessels. So once you have done this, this is a first aid, then a patient should be referred to a hospital facility. So persons who train regularly, like a person who's wanting to get into the army or into the or an athlete, so they get overuse injuries. So very commonly they get shin splints or stress fractures. So all these can be actually managed with proper treatment, with proper rehab, proper stretching. So there's a lot of time, there's lack of warm up and cool down in the regular regime, which lead to all these stress fractures. So you just need to look at the cause of the problem and treat it accordingly. So tennis elbow is very common problem which we commonly see in all the many students who are like they get the pain in their elbows because of constant use of mobile phones, constant use of laptops, desktop, because our life is totally based on gadgets nowadays. So we need to modify it. So we need to exercise a lot. So to get rid of these pains, you just need to do a proper exercise, proper stretching, maintain proper posture. As sir also pointed out earlier in his talk that we have so much based on our laptops or mobile phones that we have forgotten to carry our pen and notebook along with it. So it's very important to always carry a notebook or a scribbling pad which you can just keep it in your pocket, and you don't have to carry big bags to carry your pads. You can keep it in your pocket, you can have a pen, and just not be dependent on mobile phones. So getting into the management of all this, rehab and corrective exercises are crux for it. A proper physiotherapist who does proper manual therapy is actually is gift to you, so he can do a lot of wonders with just a proper rehab and corrective exercises, working on the biomechanics and getting the things right. So doing the manual therapy will make the things very easy, and you can actually do various treatments with simple exercises and following those exercises in your routine, maintaining a proper posture, and hence treat the problem. So more importantly, I think one of the speakers will speak on this also. So kinetic chain is very important. It's from head to toe. It's just not a single part which is affected. So at times if there's a break in a kinetic chain, there can be a problem in the core and it may reflect on the shoulder. So you need to look at the patient. If someone comes to you with a shoulder pain or with a back pain, you need to look at all the aspects of the patient and just not the area of pain which patient is telling you. So you need to assess the entire chain. So biomechanics are very important, and these should be read, and you should know where exactly the pain is coming from. But I have seen many patients landing up there and getting some sort of treatment which is actually it should not be encouraged, and it should be discouraged as much as possible, because you can injure yourself and harm yourself, which can lead to dreaded complications. So we have got many patients who have got treated with very simple form of exercises, and they have started loving their sport, even going to gyms, going to paragliding, so for which they were advised surgeries at many places, but they never needed surgery for that. So you need to diagnose a problem which doesn't need a surgery and do a lot of proper exercises and go back to your routine, or go back to do whatever you like. So I was talking about injury prevention. It is very important because many people I see, even if I go to a gym, I have never seen my colleagues or my friends who are working in the gym to do a warm-up. So no one does a warm-up. So just come to the gym, do some exercises, do some weight training, do some dumbbells, and all done and go back. Sit, chit-chat and go back. So that's an improper form of exercise, which should not be done because that will lead to more problems than advantages. So a proper warm-up, which includes dynamic stretching, should be done. I'll come down to the video how it should be done. So, and I want everyone or a person who is exercising regularly should do these properly before start of his exercises, and a cool down, that is a static stretching, should be done at the end of the exercises. And they should maintain a proper hydration while working out because water content in body is very important. So nutrition plays a very important role. Then to use a proper equipment while in the gyms or while in the field if you are playing any sport, and to train your kinetic chain properly. So this is very important. This is how you can prevent your injuries to happen, so that you can play for a longer time. You can do whatever you want. You want to go for a treks, you want to go for hikes, you can do, and you will, I think you will be more mentally fit if your body is fit. So in proper warm-up, can I have a show of hands? How many of you go for regular exercises? So on my right, I think many people on the left, oh, very few. So how many of you warm up before exercises? How many of you cool down after your exercises? Everyone, perfect. So how do, any one of you can answer, how do you do warm up? So anyone, not a chorus answer, anyone can get up. If you can get up, give them a mic. How do you do a warm up? Yeah, please. So what exercise do you do in warm up? So these are the rotation exercises. Basically, you have to open up all your joints, you have to open up all your muscles so that they start working out. So this is a very small video which shows that it's giving you an idea that your entire joint should open up before you start working out, or before your any regimen. Even if you are working in a field, if you are going to play any sport, so you can do a basic warm-up and then a sport-specific warm-up, which will definitely prevent the injury which is happening to do. So once you are done with a gentle warm-up, so spend a good time on your workout, whatever you want to do, and then do a proper cool-down. So what involves cool-down? Anyone? So this is being asked so that you don't sleep. So what's in the cool-down? Anyone? So stretching. So as I said, it's a static stretching. So you need to stretch all your muscles, just not the part which you have worked out on that day, but it's very important you stretch entire body, and which will give a fascia and a muscle a proper length. So because muscle has acted over a time and the length shortens, so we have to increase the length so that it glides properly with the fascia and give less chances of injury in your subsequent workouts. So cool down doesn't mean that sitting in a gym for another 10 minutes talking to your friends. That doesn't mean cool down. So if I come down to the particular joint which can get injured, so knee is a very common joint which get injured nowadays while playing in this while playing sports or in the gym as well. So there are certain ligaments which are all around the knee and the cartilage which are of interest when these get injured, and we commonly hear that a person getting injuring his ACL or the anterior cruciate ligament, which is very common in an athletic population who play contact sports or non-contact sports. PCL is a posterior cruciate ligament which can also get injured in contact sports more likely and more commonly in the road traffic accidents. So there can be combination of these ligamentous injuries which can lead to a multi-ligamentous injury. There can be a damage to menisci. Menisci is a very important structure in the knee joint which gives us shock absorption to the cartilage and prevents the cartilage degeneration. So if we talk about ACL, which is a anterior cruciate ligament which gets torn, so these are the few clippings. A cricketer who is trying to fetch a ball lands on his ankle, on his leg, and he just get a hyperextension kind of injury and tears his ligament. Similarly, a person in a gym who is trying to work out snaps his ligament and he just falls down when his tibia is unable to control and the ligament snaps. So these guys, they just undergo a simple ACL reconstruction, which can be done with any sort of graft, from a hamstring for a bone patellar graft or from a quads. And there are no big incisions which are required to be made. A 30 to 45 minute surgery, and you give, if tunnels are made in a proper anatomical location, you get the best results. And we have got very good results in these kind of patients, and they have gone back to their sports or to the gymming, or by 2 months they can go back to the walking, cycling, but the running part or getting back into the sports take around 8 to 9 months. By the time when the tendons have become a ligament, the process of ligamentization is complete. So just doing the surgery doesn't mean that we are just treating this problem. We have to prevent the chances of re-injury as well. So this was the same boxer in blue now who was in the first video. So he was able to go back to his sports after proper assessment at 9 months, and he brought laurels to his team. So ACL reconstruction should be individualized. It's just not one recipe for everyone. So it has to be individualized as per the needs of the sports person, as per the sport of a sport person, and as per the body weight and the height and the requirements. So you have to use different sort of permutation and combinations to treat a particular person. It has to be tailor-made, and it cannot be generalized to everyone, that a single surgery fits or a single type of technique fits everyone. So you need to know everything and then jot down to a certain point that this treatment is for this athlete or this treatment is for this person. So similarly, this is a contact sportsman. He also injured his ACL, but we use a different graft in this patient. We use a patellar graft because he's a kabaddi player. So again, after around 8 to 9 months, he was able to bring back laurels to his field, to his team, and it was a win-win situation for both patient as well as the surgeon. So he was very happy using a bone patellar bone graft as his ACL after the surgery. Now it comes when every one of us know that there is a ACL injury and people come to us very early. They don't delay their problems for a longer time. In such situations, the remnant or the stump which is already there can be used along with the new graft. So we have published this technique of a remnant preservation which leads to early and accelerated rehab. A better proprioception is attained at the end of the treatment or at the end of ligamentization. There is better ligamentization because the vascularity from the available stump is better as compared to the just a graft, and there is a better ligamentization of the graft. So this the tendon, whatever we are putting in, or an autograft we are putting in, gets a better collagen tissue, better type of ligament than a tendon. Sometimes when there is a chronic problems, there can be a lot of laxity in the knee joint. So in these patients, we just have to stop just by doing an ACL. But then in these patients, we have to add an extra ligament or a tenodesis effect kind of effect on the lateral side of the knee, so that the laxity of the knee joint decreases. So we may have to add an extra, so that as I said, it has to be individualized. You cannot put one treatment to all of the patients. So it is a matter of pride and honor for us that we were first in Punjab to do some kind of dual ACL, in which we use a muslin tape and along with a special plasma coating to incorporate it with a ligament, with a tendon, so that patient can go back and return to sports early. There's early ligamentization of the graft. Along with this, there is another thing called BioBrace, which is the active collagen molecules, which has to be imported all the way from US to do it along with the graft. So this is a BioBrace, which has been transplanted along with the graft to give more vascularity, more collagen tissue for a graft to heal. So these may help in returning to sports early and prevent re-injury also. So sometimes many patients have already got an ACL surgery done, so which fails at a time. So then we may have to do a revision ACL, but there are many things which needs to be looked upon when you have a primary surgery which has failed. So it's just not the ligament which we have to look into, but it's the bony alignment, bony slope. So in this particular case, the slope of the tibia, the posterior slope of the tibia was more. So in such scenario, we have to correct the slope along with doing a revision ACL. So a slope correction was done, which was brought to normal, so that there is no chances of graft re-failure. So failing again can cause hazardous. So there can be decrease in competence level of an athlete as well. So these were the healed scars, and this was a 9-month follow-up of the same patient who was from the army, and at 9 months, through proper rehab, through proper neuromuscular training, he was sent back to his sports. He was a handball player. So he started running, balancing at the end of 9 months. After his functional assessment, he was sent back to field. So another case, he was again a kabaddi player who got a revision ACL and a high tibial osteotomy, which is nothing but a alignment correction, because his knees were getting bored because of his previous surgery which failed, and there was a cartilage loss as well on the medial side of the knee. So to prevent this, we did a revision ACL along with a high tibial osteotomy, correcting the bony alignment. So this was his 1-year follow-up. So looking at all this, so I would say alignment is very important. Then comes to so it's an ABC of the ligament injury, which means A for alignment, B for the bicruciates, and C for the collaterals and the cartilage. So cruciates are very important, but before that, alignment. So ABC should be remembered. So at 1 year, he was able to do all his gymming activities, all the high-end heavyweight training, and even play kabaddi. So meniscus, which are disregarded as a vestigial organ, and I have heard many times, if you got a meniscus tear, just throw it out, just cut it and let it go, because it is a vestigial organ. So I would say no, because it has very important function of being a shock absorber. So it prevents the cartilage to degenerate. So when you get this kind of a meniscus tear, which is commonly associated with an ACL deficient knee, it needs to be sutured back, it needs to be repaired. So the suture needs to put across this meniscus so that we can prevent the cartilage damage. So there are various techniques to skin a cat. You can do various inside out, outside in, and many techniques to do this. So these meniscus repair, they are considered to be avascular. So there's a thought process that there is no vascularity on the inner side of the meniscus. However, the peripheral meniscus tear, they have got a good blood supply. But however, to augment these repairs, we can augment these with the blood clots. We can do a fibrin clot, we can do platelet gels to enhance the repair. So this will increase the longevity of the knee, give a better results, a better stability to the knee. So PCL is a ligament at the back of the knee, so it's very important. It doesn't provide major stability to the knee, but it provides a central pivot. It's a central pillar of the knee which gives knee its balance. So knee try to pivot around it. It is a much stronger ligament than ACL. So in this, the tibia sags down posterior. It goes back all the way. So whenever there is an injury from the front or there is a dashboard injury, this PCL can injure itself. So in this, we have to do a PCL reconstruction. There are special techniques to do this. Again, you can do a single bundle, you can do double bundles. So again, a double bundles, PCL means 2 bundles are being reconstructed, is a preferred technique to give a proper strength to the knee. Because most of these patients, if coming to us late, they get an anterior knee pain or a chondromalacia patella, which is very common because of the tibia sagging posteriorly and femur rubbing in front of with patella. So most of these patients come to us with knee pain rather than instability. So collaterals, again, they can be injured by themselves or as a part of a multi-ligament injury. So this is a MCL, which is on the inside of the knee. So if this is injured, so this patient basically had a multi-ligament injury which included MCL, ACL and PCL. So to address these kind of situation, we have to do a two-stage procedure in which the collaterals are reconstructed first, and at around 2 to 3 months when knee gets the full range of movement, we do an intercruciate or a bicruciate reconstruction. So this was his 2 months follow-up. So we did a MCL reconstruction. His knee was very stable on the medial side. And then we went ahead and do a multi-ligament reconstruction, that is ACL and PCL reconstruction. This is a new PCL and the other one was a new ACL. So bony avulsions are very common in adolescent age group. Adolescent, because the physis is slightly weaker than the ligament, so the bone tends to rip off along with the ligament. So these patients, earlier they were treated with putting in a screw and an open surgery, so which have actually the skill, the proficiency level of the surgeons has also increased. So we have started using an arthroscopic technique and putting in these tapes to hold the bone back. And this was the post-surgery fixation, so that we can't see any metal inside the knee joint, and there is no need to remove that also. And it gives a better outcomes as compared to a screw-in technique. Similarly, a PCL can also be reversed, but at times this is missed because the proper X-rays are not available. So one has to do a proper X-ray so that you see both AP and lateral view and not miss on any injury. So these can be again addressed arthroscopically with a tape, and a bone can be fixed back onto its original place along with the ligament. So these are the post-operative X-ray. We can see this piece which was flying off of the bone has gone back and sat on its bed to get a good healing. So bone heals to bone very well and give a good results. The cartilage, which is a big thing in adolescent age group, commonly in a younger age group who are in like second decade of their life. So this is a cartilage. A cartilage defect can happen because of less vascular tissue, or because of an injury. So this is a 15-year-old chap who had a cartilage or an OCD, osteochondritis dissecans, bone fragment along with a cartilage try to ripping off from the bone. So in this situation, we put in a biopins to hold this back, and so that this cartilage comes over it and it heals over the time and the natural joint is preserved. Sometimes this big cartilage is not attached to the bone. In such scenarios, we have to do an osteochondral plug which needs to be implanted back from another area of the joint and give a natural looking cartilage over this area. So that's how we harvest a plug from a less used area of the knee and implant it here. But at times we can see a big defect. So these kind of big defects, you cannot do a refixation, you cannot do osteochondral plug transfer. In such scenario, you have to take out the cells in stage 1, send them for culture and reimplant those. So if this big area is a defected area on the knee, then we have to harvest this plug and send it to a lab for a culture where you get a similar chondrocytes or similar cartilage cells, and you get this chondrocyte in form of these vials, and then you reimplant it over the area in a mini open fashion, and these are the cartilage cells which forms a layer of a cartilage and prevents a further knee damage. So joint preservation is very important. So it should be preserved in maximum of the individuals wherever possible, because every one of you must have heard that everyone here and there getting a joint replacement. So when whosoever get a knee pain is a candidate for joint replacement. That's not true. So we have to preserve the natural joint, because there is nothing, anything like which has been made by the God, and it's a natural joint. So when we can preserve the joints, it's better to do a joint preservation rather than joint replacement. So it's very important to get a proper X-rays. So people, they were sent to me for the normal looking X-rays, but when we got a monopedal weight bearing X-rays, we got this kind of picture, which means there was medial joint which was trying to wear off in a lady who was just 38 years old. And we can see the deformity in this knee. So we managed it with a high tibial osteotomy, prevent offloading this side of joint to the center of the joint. And this was her 6 months result. She was able to squat, she was able to sit cross-legged and do all her household chores, preventing her natural joints and giving longevity to her natural joints. But sometimes the deformity is too big that you may have to do a correction at a double level. So correction in both the bones when there's a big deformity like this, which is almost like a C-type. So you double the level and your troubles are to the half. So this is a person who is walking with a varus thrust gait, and he has his ACL deficient knee. So we did a double level osteotomy along with an ACL reconstruction in this patient. So there are a lot of calculations which are required for doing this corrective osteotomies or making the leg straight. So we did a double level osteotomy on the femur and a high tibial osteotomy on the tibia, and also we reconstructed the ACL. So giving him a straight appearance. This was his 6 months follow-up. So this was his limb which was bent, and he got a straight limb. So he has got some varus on the other side also. We are planning another surgery for him on the other side by another couple of months. So he was an avid volleyball player, and he has started playing volleyball now, which he was unable to do from past around 8 years, and he is one of the happy patients. So moving on to the shoulder. Shoulder again is one of the neglected joint. Whenever we see patients, anyone getting a shoulder pain used to get a lot of corticosteroid injections into shoulder. Anyone going to a doctor or to an orthopedician saying that I have a shoulder pain, so he was given multiple shots of steroids, but it should be used with a caution, because nothing comes without any disadvantage. So the use of steroids intra-articularly should be discouraged, because they can cause a lot of problems to the tendons of our rotator cuff, which can eventually get torn and cause problems in a younger age group. Another common problem with younger athletes is shoulder dislocation, or the throwing athletes who tend to dislocate their shoulder. But some people who can dislocate their shoulder by themselves, one has to be very careful, because they can have a multi-directional instability, and you just need to work on their muscles. But persons who get a traumatic dislocation are treated with a simple Bankart repair, which is an arthroscopic procedure. However, when there are multiple episodes of dislocation, there can be a bone loss. So there can be bone which gets eroded from the glenoid side and a bone which gets eroded on the humeral side. So one need to look at the bone loss and do a Latarjet procedure or a bony procedure in these patients, because a soft tissue procedure can eventually fail in these patients. So this is his 4 months follow-up. He was from the army, and he has gone back to his sports, playing badminton, racket sport, after his surgery. So rotator cuff tears are common problems in an elderly age group. So this lady who was around 60 years old, she had a fall and was unable to elevate her arm. So we did an arthroscopic double row transosseous equivalent kind of repair. So this rotator cuff tissue has to be made to heal to this bone so that it heals over it, and she regained her function of the arm and was very happy with the function of the arm. So similarly, these patients or a younger age group patients can have a massive cuff tear, or the cuff tear or a rotator cuff tear which has torn and gone all the way back till the glenoid. So these tissues cannot come back. So in such scenario, you have to do a superior capsular reconstruction, or you have to harvest a IT band, a fascia lata band, and put it in the shoulder, fix it on the glenoid side, fix it on the humeral side to get the proper range of movement. So this lady was from Canada. She was a beautician by profession and she injured her shoulder. Canada, the process of getting a treatment is long. So for getting her MRI, it took her around 1.5 years before getting a list for and going in for surgery. It was around another 1 year. So she traveled all the way back to India to us, and this was her 8-month follow-up. She was able to do all the weight training by herself. So she coordinated with us on WhatsApp. We were telling her all the exercises because she was supposed to be in Canada to get her PR or the PR work done. So this was her 8-month follow-up, and this was done around 4 years back, and she's still in touch with us, and we keep on getting many patients all the way from Canada to get the treatment here. So when there's a massive cuff tear, the joint can get eroded. For the elderly patients, the solution only is reverse shoulder arthroplasty when there's a joint problem, so you cannot do the soft tissue surgery. So then we have to replace the shoulder and get the good movements. So this should be particularly restricted to the elderly age group, should not be practiced in the younger age group. So people who are doing a lot of weight training, they can injure their elbows. Most common of this is a distal biceps tear. So he was a calisthenics athlete who ruptured his distal biceps while doing training in his gym. So we did endoscopic distal biceps repair. So distal biceps tendon was put back onto the radial tuberosity, and these were his results at around 6 months. He was able to do all the flips by himself, and he's got good biceps contour, good strength, which is very well evident from this video. So chronically missed distal biceps tears are also there, so in which we have to do a reconstruction. We have to harvest a tendon from the body and put it back. So, and more importantly, psychology is very important. Again, it was spoken about by sir that psychology, so looking at the psychology, a person who is mentally fit can actually perform very well. Even with a milder form of injury to his either of the ligaments, either of any shoulder or the joints, if patient is very focused, if athlete is very focused, he can get the best results out of any kind of treatment. So psychology is very important. Of late, the more important aspect, there's a lot of cost which is involved in the treatment. So to cut down the cost, so this Abhinav Bindra Foundation, which has collaborated with us, so it's an honor for us that we help these athletes go back to the athletes in which the implants, whichever is required in the surgery, is sponsored by the Abhinav Bindra Foundation, and we cut on the surgical fee of the patient, and patient just have to pay for their medical expenses. That is just medicines, which is almost negligible for the athletes who cannot afford their treatment. So with the motto for sports for all, so we have collaborated with the Abhinav Bindra Foundation to give a free treatment to the injured athletes. So take-home message, I know it was a long talk, but injury prevention is very important. Do a proper assessment, proper diagnosis, and doing an appropriate treatment for a particular patient. So one treatment is not made for all the patients or all the athletes. It has to be tailor-made, customized, and a proper rehab should be done so that a comeback is always stronger than a setback. And one athlete can go back to his sports, he can run even faster than the cheetah. Thank you. So questions are welcome.
Any questions? May I have the raise of hands, please?
Hi, sir. First of all, thank you for the lovely talk.
Thank you so much.
It's in first time I'm hearing from an orthopedic surgeon from like as the voice of physiotherapist. So it's a lovely honor to hear you. Can we have a great round of applause for sir, please?
Thank you so much.
Thank you, sir. Thank you for the support. Sir, actually, I work in a sports ecosystem, and I do have certain question. It's not a question, it's basically doubt which I wanted to clear. First is basically regarding the ACL graft that the surgeon uses. So nowadays in sports we see that they are moving from the hamstring graft towards the adductor magnus graft sometime. I heard somewhere, I don't know if I'm right or wrong. So can you please throw some light on that? I'm having a number of questions, so this is first of them. Yeah, please.
So, thank you so much for your kind words. If I feel a physiotherapist or a psychologist, they play an integral part of the team. It's just not a surgeon who is doing the job. It's a physiotherapist, I would say, they do more of the job than a surgeon. So using a particular graft in an ACL deficient knee depends upon the need of the patient, as I said. So a person who is playing a contact sports or who's a footballer. So if I use a hamstring in those patients, so hamstring the flexion strength of the knee decreases. So for a footballer who has to kick a ball, he needs a good flexion strength. So if he can recoil his knee backwards and then push it, he can get a ball going further apart with a more force. So in those patients, I would prefer using a bone patellar bone graft rather than a hamstring graft. Similarly, if I get a badminton player, I would prefer using a hamstring graft because that patient doesn't need a high flexion strength to get back into the sports. So more commonly, and it's not an adductor magnus, which is the other popular graft which is coming off late is peroneus longus graft, which is from near the foot. But it's been just around 3 or 4 years in which it's being used. It is a promising graft. I would not like to use it as a primary graft in most of my patients, but in multi-ligament scenarios, yes. It's a very good graft, but primarily I will be sticking onto the quads graft, hamstring graft, and a bone patellar bone graft. So peroneus graft, the long-term effects on the foot can affect landing of the patient on the ground. There can be drop in the arch, and which can give foot problems to the patient. So footballers, if we are using a peroneus longus graft, they can have decreased eversion strength, which is very important for them.
Okay, thank you. The second is actually I'm a biomechanist there. I'm dealing with the biomechanics analysis and all, and I'm involved in the rehab also. So I basically check the status of the rehab, like what need to be done and how far we have moved. So that's my personal observation that when a person is going for a rehab after a surgery, the concentric strength that we are basically getting very easily, but the part which we are lacking is the eccentric strength. And the eccentric strength is the one which again I have observed in the sportsman that may lead to a reason for the recurrent of the injuries. So actually from the stage, because as you are on the stage right now and the students are hearing you, so can you please tell the importance of the eccentric strength as well, so that the physio can focus on that?
I think you are a better guy to speak on that. So, but anyhow, whatever knowledge I have on that is from the rehab part.